My name is Hameem Changezi. I'm an interventional cardiologist at McLaren Hospital. All interventional cardiologists are general cardiologists, so we pretty much treat all cardiovascular disease. But as an interventional cardiologist, our precise specialty is to deal with coronary artery disease and blockages. And not just medicinal treatment of blockages, but interventional treatment like putting in stents and doing balloon angioplasties. Unfortunately, in our country here, heart disease is way too common. And the major ones would be high blood pressure, congestive heart failure, atrial fibrillation. Those are the big ones. Of course, coronary artery disease. Congestive heart failure in our country, the biggest cause of that is coronary artery disease. So those are the major ones. But of course, there are things like valvular heart disease and cholesterol problems. Also now more and more people with congenital heart disease with more advanced surgical techniques are growing up into adult life. So we're also dealing with more adult congenital heart disease. A little bit of apprehension is normal. I'm apprehensive driving in the snow. But we all make decisions based on risk and benefit. Obviously, if a heart catheterization is being recommended, then their physician feels that the benefit to be achieved far outweighs the risk. I would say that heart catheterization is a very safe procedure. The probability of a complication is 1 in 1,000. More than a question, I think the most common thing I hear is a statement that, but I've never had heart disease. I mean, we've never had something till the day we have it. But usually it's an element of denial, if you will, initially. That's quite common, but eventually we all come to an acceptance that, we need to modify our lives to live healthier and longer. I always joke with my patients that think yourself as a pickup truck. Your heart's the engine, you're the weight in the back, and blood pressure is the mountain you're trying to climb. So if the pickup truck is new and you don't weigh a ton, then you can climb any mountain you want. However, with time, as the truck ages or the weight gets heavier, you don't want to pick a tall mountain. You want to keep that mountain as low as possible to improve the longevity of your pickup truck. Most of us think we have very healthy diets, but actually we don't, especially sodium. Because we need to be a little more cognizant in reading the labels of what we are purchasing as food and how much sodium is in there per serving. The average daily allowance is around 2,400 milligrams of sodium a day, and an average person in our country here gets about 3,000 milligrams. So everybody is getting a little too much sodium. Sodium actually is a driving force for high blood pressure, and then of course it's the first domino, and then blood pressure leads to congestive heart failure. Well, most common signs of a heart attack, the classic signs are pressure or heaviness in the chest, a feeling of a weight across, inability to take a big breath. However, those signs are classically seen in men, and previously, I must say, physicians were a bit sexist. We thought that heart disease only affected men. However, we stand corrected. Ladies also are at an increased risk, especially after menopause. Their risk of heart disease actually accelerates and catches up with that of their peers, male peers. And in ladies, the symptoms are more, shall we say, vague. It can be fatigue, it can be upper back discomfort, it can be just shortness of breath and diaphoresis. Rarely do women present with the classic pressure. When you call 911, you will have people responding to you immediately who are trained to deal with emergencies. They have equipment to help with the initial treatment. So rather than putting somebody in a car and trying to break some red lights and drive over here, it is wiser to call 911 because time is of the essence. Time is muscle, heart muscle, and the more heart muscle we can save, the better the outcome.